We are very fortunate here today to have two doctors with us to share their expertise in an area that impacts many people here in West Michigan, obesity.
That's right. We've been following the journey of Michelle Merriman through bariatric surgery at St. Mary's for months now with some incredible life-changing results.
Her Dr. Paul Kimmeter is here along with his colleague, pulmonologist Richard Levy, who work together to address many issues related to obesity that can be greatly improved with surgery. And Dr. Levy, why don't you start by talking about some of the risks of obesity?
Obesity, plays a role in any field of medicine. In pulmonary, it does because of a term called obesity hypoventilation syndrome, otherwise known as Pickwickian syndrome. And essentially, it's a crushing effect to the lungs because of the weight. I often tell my patients, it's kind of like if you were to lay flat and put a couple of books on your chest. You'd be able to breathe, but not very well. It would be more difficult to breathe. I have some patients where obesity becomes such an issue that the physiology of the lung has changed. They can't expand as well, they don't breathe as efficiently, and they actually require oxygen because of that. And these are young patients. I mean, we're talking 30, 40, 50-year-old patients, never smoked. The lungs themselves are healthy. They've never exposed themselves to anything, horrible, or as I said before, they never smoked, but yet the physiology of the lung is such that they need oxygen. They can't do their activity, and that becomes a huge issue. Especially when we're dealing with an obese patient, we're always saying, well, lifestyle changes.
Right.
Food is one big issue, but also exercise. But, these patients, it's unfair for me to start demanding exercise in them when the physiology of the lung almost won't allow it.
And it makes it even more difficult.
Right. Oh, yeah. Much more.
And that's where, we talk about bariatric surgery, Dr. Kimmeter, and we know we've been following Michelle through this process, but people really get to the point where that's the most important act that they can take is going to you for surgery.
Yeah, I think the issue is that the average person will think, well, just stop eating as much as you're eating. But the disease of obesity is much more complex than that, and we've talked about that on shows previously. And so when these patients get to the point where, especially Dr. Lovey's seeing them, it's a life-threatening condition. And if we don't act together as a team, and one of the reasons we wanted Dr. Lovey here today is to show that it's a teamwork approach to address the complications that are associated with obesity.
And some of the effects, I guess, we're talking a little bit about what happens before and then the surgery. Does it immediately change the whole, system after the body starts to change and the habits start to change a little bit?
It does, actually, and it's actually amazing to see the effect because, again, the lungs themselves are healthy. They really are. In these young patients, they're beautiful lungs. And what happens is I see the effects almost immediately. I think faster than you do, because they'll come and follow up with me, and I'll have complete workup, pulmonary function tests, see the strength of their lungs, the restrictive component their lungs have. Then after even 20, 30, 40 pounds of weight loss, it is amazing the amount of functionality their lungs regain.
Is part of that, too, then, people who are obese may be feeling so tired that they right away get that energy because they're getting more oxygen, and that's really allowing them to have more of an opportunity to participate in those activities.
That's actually exactly right, but on so many different levels, because there's also what happens is sleep apnea plays a huge role in that as well.
Okay.
Obesity with obesity hypoventilation syndrome often leads to sleep apnea, and then sleep apnea then leads to more obesity. It's this cycle. And, getting this treated, their energy level increases, their motivation increases. One of the reasons why I like referring off to Dr. Kimmeter and St. Mary's is because it is an entire system approach. There's nutritionists, there's counseling, it's a whole... It's not just referring off to one surgeon, it's a whole process.
Right, and we talked about one of the effects here with the lungs, a very important thing, but there are a lot of other risks with obesity too that you have. You're talking about blood pressure and all kinds of things too that makes bariatric surgery a real good option for people.
Yeah, it's a life-saving operation, and it's why I do what I do. And Dr. Lovey has all these sophisticated tests he can do to show that the lungs are better. What I love to hear is when the patient says, "I feel 10 years younger."
Yeah.
I'm doing things that I couldn't do 10 years ago, or I've never been able to do this in my life. I have my wife's cousin, actually, I did his surgery. He is now running half marathons.
Wow. Really?
Never in his life would
It's like
he
getting
have
your
ever
life back,
considered
but a healthy version of it.
It's a totally different life for him, and it just makes you feel so good. He'll call and leave messages on the answer machine. This is what I did this weekend, and I'm just like, that just is so cool to hear that. You know?
And it just makes your mission in life that much more important. How can people get in touch with you? I mean, it's been really great to get to know you over the last years. We followed Michelle through her process, through her surgery. There are great ways for people to connect with this information.
Sure. You know, the internet, I find, I'm finding more and more is probably the best way to get information. But through St. Mary's, there's the SM Let Go website. There's a phone number that people can call, 685-333. It's 3333. It's very, it's on the screen.
And then also even connect with Michelle. It's amazing.
Yeah,
She's walked through this whole process and has been very open with the struggles and the highs and the lows that she's experienced. And so I know that there have been people that have contacted her, and she's been able to help them, and it's been amazing.
Absolutely.
Yeah. Well, and if you're sitting at home thinking about this, really connect with them, because they'll be able to assess you, do an evaluation, and see if you are a candidate for this. Because don't let another year go by suffering at home with obesity, because there really are some great options for you out there. Thank you so much for being part of this.
Yeah, for all the hard work you're doing.
Yeah.
All right.
Yeah. We'll be right back.
Are you West?